So today, I want to talk about the signs that could happen, or we call them the symptoms that one could see, and it could be cervical cancer. Cervical cancer does not happen overnight. Cervical cancer progresses over a long time after exposure to infection. So the cervical cancer has stages. We have stage 0, stage 1, stage 2, stage 3. In stage 0 and stage 1, you might not see any symptoms. It's usually asymptomatic. But when we start venturing into stage 2, you start seeing some signs and symptoms. And these signs and symptoms are, you might start getting discharge. This discharge, you might think it's normal, but with days, it increases. And you can't even go without wearing a pad. And with time again, it starts developing a very bad smell. The next thing you might see is painful coitus. When you're having sex, you feel pain. If you feel pain and you're not feeling pain there before, it is important for you to come to the facility for checkup. The next thing is bleeding after coitus, or bleeding after doing strenuous exercises. Maybe you're going to a long call and you're straining, you might bleed, or you're carrying a heavy load, you might bleed. If you do that and you're bleeding in between your periods, then that is a sign that needs to be checked out. The next thing that you could feel is pain around the pelvic region. If you have pain along the pelvic region, that is your lower abdomen, your back, it is important to come for checkup. We are not saying it is cervical cancer. What we are saying, come and get checked. And if these cells have started changing, we can curb it early before you develop into cervical cancer. Kindly get checked. Prevention is better than cure. Get screened early. Make sure you have your annual screening to prevent this.